If you've been researching Medicare and weight loss medications lately, you've probably heard the claim that Medicare beneficiaries can get Zepbound for just $50 a month. When I first saw that, I thought, there's no way. Because anybody who's looked into GLP-1 medications knows that they can cost hundreds or even thousands of dollars without insurance coverage. But here's the surprising part. The $50 price appears to be real. And the question isn't whether the program exists, but the question for you is whether you qualify. And that's exactly what we're going to be talking about today. We'll look into what the Medicare GLP-1 program is, who may qualify, what the limitations are, and whether retirees should be paying attention to this program. And as someone who's about to transition onto Medicare myself, this isn't just another news story. It's personal. Let's start with the basics. Zepbound is a GLP-1 medication manufactured by Eli Lilly. It's designed to help people lose weight by reducing appetite, slowing digestion, and helping people feel full longer. For many patients, the results have been nothing less than dramatic. People have reported significant weight loss, along with health improvements for blood pressure, mobility, sleep apnea, and overall health. The biggest barrier has always been the cost. That's why this Medicare Bridge program is generating so much attention among retirees. Let's be honest. Maintaining a healthy weight gets harder as we age. Our metabolism slows down, we become less active, old injuries start to catch up with us, and many retirees, many of you, are dealing with conditions like high blood pressure, sleep apnea, joint pain, heart disease risk, prediabetes, or even diabetes. And so weight loss is not just about looking better. It's about staying healthy to enjoy your retirement. It's about remaining independent in your retirement. It's about reducing health risks and the associated health costs as we get older. And that's why so many Medicare beneficiaries are interested in GLP-1 medications. Recently, CMS and Medicare announced details of a temporary program known as the Medicare GLP-1 Bridge program. The program is currently scheduled to run from July 2026 to December 2027. The goal is simple: provide eligible Medicare beneficiaries access to certain GLP-1 weight loss medications while Medicare coverage rules continue to evolve. Think of it exactly like the name suggests. It's a bridge, a temporary pathway designed to help eligible beneficiaries gain access to these medications at a significantly lower cost. Now here's the big question, and it's what I had as well. Can Medicare beneficiaries actually get Zepbound for $50 a month? The answer appears to be yes. And I know that this is true because I was at CVS yesterday and I saw an Eli Lilly pharmaceutical rep talking to the pharmacist, explaining the limitations and the restrictions on the program. So I know that it is real. And for eligible participants, the current program guidance indicates that qualified beneficiaries may pay a fixed $50 a month copay. That's a huge difference compared to what many people have been paying out of pocket. But here's the important part. Not everyone qualifies, and that's where much of the confusion online begins. Eligibility depends on several factors. First, you generally must be enrolled in Medicare Part D prescription drug plan. Not all Part D prescription drug plans are the same. You must check that. Second, your physician must determine that the medication is appropriate to your situation. Third, program rules and eligibility requirements must be met. And here's something that most people don't realize. The Bridge program is primarily focused on weight management access. Some beneficiaries who already receive GLP-1 coverage through Medicare Part D for other conditions may obtain their medication through their existing Part D coverage instead of the bridge program. So you can see that this isn't a blanket program that gives every Medicare beneficiary Zepbound for $50. One of the first questions, certainly my first question, was, do I even qualify? And generally speaking, obesity is often defined as having a body mass index, or BMI, of 30 or higher. Some people with a BMI of 27 or higher may also qualify if they have certain weight-related health conditions. Now, let me make this personal. I'm about 5'11". I was 6 feet, but I've shrunk a little bit with my age. You all know how that is. But I'm 5'11" and 270 pounds. That calculation puts my BMI at roughly 37 to 38. And in addition to BMI, the doctors will also consider related health conditions such as sleep apnea, high blood pressure, heart disease risk factors, type 2 diabetes, and other weight-related medical conditions. So qualification isn't necessarily just about the number on the scale. It's about your overall health picture. And if you're wondering where you stand, it is critical that you talk to a doctor and get the information from that doctor. I want to stress that because I am not a doctor. I am not giving you medical advice. You should go to your doctor and discuss with them the use of this drug and whether or not you qualify with Medicare. Now, let me tell you why I started researching this. If you've watched my videos on this channel, Les is the New Retired, many of you will know that I'm approaching Medicare eligibility myself. In fact, in the next couple of days, I plan to apply for it. Like a lot of retirees, I've spent years, in fact, my entire life, dealing with weight issues. I also have a history of sleep apnea and high blood pressure. So when I first heard that there might be a way to obtain GLP-1 for $50 a month under Medicare, it definitely caught my attention. And it's not because I'm chasing some miracle solution or cure or anything, but because maintaining good health becomes increasingly important as we move into retirement. I know I would like to live long enough to be able to see my grandchild graduate college and get married. So if a medication can help me improve my health outcome while remaining affordable, I'm all for it. And you should be too. You should check it out to see. Now, here's a detail that many news articles leave out. The $50 bridge program copay generally operates outside the normal Medicare Part D cost sharing structure. In other words, those payments for the GLP-1 may not count towards your deductible or your annual out-of-pocket calculations the way some traditional Part D expenses do. And that's not necessarily good or bad, it's just important information to understand when you're making assumptions about your budget for prescriptions and your overall prescription costs. Now, if you're interested in Zepbound or another GLP-1 medication, here's what I'd recommend. First, and most critically, I've said it before, say it again, talk to your doctor or physician. He or she will know what your situation is far better than anyone on social media, and they will know whether or not you will qualify for this program. Second, review your Medicare Part D coverage. Not all D coverage is created the same. Third, verify the current bridge eligibility requirements. And fourth, don't rely on social media headlines, because programs change, coverage changes, eligibility rules change. Always verify the latest information from either CMS or Medicare website to understand before making important healthcare decisions based on information from the web. Now, I'd love to hear from you. Have you looked into the Medicare GLP-1 Bridge program yet? Have you talked with your doctor about Zepbound? Do you think Medicare should make weight loss coverage more broadly available? Let me know in the comments below. And if you're interested in retirement planning, downsizing, healthy living, and making smart financial decisions in retirement, be sure to subscribe to this channel, Less is the New Retired, because sometimes the smartest move isn't earning more, it's needing less. Thanks for watching, and I'll see you in the next video.